chances of having an active and healthy life. To understand coronary artery disease and what may have happened to you, it helps to know how the heart works. The heart is a strong, muscular pump, about the size of your clenched fist, in the middle of the chest. It pumps blood, which contains oxygen, to all parts of the body. The heart muscle itself gets its own supply of blood and oxygen through blood vessels on the surface of the heart, called the coronary arteries. Over many years, the inside wall of these arteries may narrow and become roughened by fatty deposits called atheroma or plaque. This is called coronary artery disease. This can also happen in other arteries throughout the body. You may be wondering why you have narrowings in your arteries. A number of factors can lead to narrowing of the coronary arteries, increasing the risk of angina and heart attack. These are called risk factors. It's important to know if any of these risk factors apply to you. The more you have, the more likely you are to develop coronary artery disease. The good news is that most risk factors can be changed.
Now is your chance to reduce the risk of further problems. This is a condition that we understand well, and we've got excellent scientifically proven treatments. Now, of course, there are some risk factors that you can't do anything about. Increased age, being male, having a family history of heart disease. Some nationalities have a higher risk, such as Maori, Polynesian, or Southeast Asian. But there are a large number of risk factors that you can do something about. Giving up smoking, lowering your cholesterol, reducing high blood pressure or hypertension, managing your diabetes well, maintaining a healthy weight, not carrying excess fat around the tummy, exercising regularly, managing stress. If you adhere to all of the treatments we suggest and make the lifestyle changes, you can reduce your risk of a future heart attack by as much as 70 to 80%.
Angina is the name given to discomfort or pain caused when the heart muscle is not getting enough blood and oxygen. This is caused by narrowings or plaque in the coronary arteries. It usually happens when your heart is working harder than usual, such as during exercise, emotional upsets, after eating a large meal, or in very hot or cold weather. Symptoms of angina may be a discomfort or a feeling of tightness, heaviness, burning or pressure in the chest. You may also feel this in the neck, throat or jaw, down one or both arms or between the shoulder blades. It may feel like indigestion or even a pulled muscle. You may realize that you've had these symptoms for some time and not known what they were. Often angina goes away with rest because there is less work for the heart, or it is relieved with nitrolingual spray or GTN. Be sure you have a GTN spray and know how to use it. You should spray GTN into the air to be sure it works before spraying it under your tongue. Do not shake the container and check the expiry date. Nitrolingual spray works by increasing the blood flow to the heart muscle. It is quick acting and should relieve the discomfort in a few minutes. It's not harmful or addictive. It may cause a headache or dizziness due to widening of the blood vessels and sometimes a drop in blood pressure. If angina occurs, stop what you're doing, sit down and rest. It may go away after a few minutes. If not, take 2 sprays of the GTN under the tongue and wait for 5 minutes. If the pain or discomfort is still there, take another 2 sprays under the tongue. If the pain or discomfort is still there in 5 minutes, take another 2 sprays under the tongue and wait another 5 minutes. If the angina has not gone away after 3 doses of spray in 15 to 20 minutes, ring 111. Remember, angina does not damage the heart muscle and should be relieved by the spray. If it is not relieved in 20 minutes, it may be a heart attack, so ring 111. You need to come to hospital by ambulance. This is very important to make sure you get early treatment if it is a heart attack.
If in the future you develop angina or your angina becomes worse, then that's the time to seek medical help. Now, by getting worse, I don't mean that the pain gets more severe, because most angina is only felt as a discomfort. But if the angina occurs more frequently or comes on with lower levels of exertion, then that's the time to see your doctor, who might arrange some tests or send you to hospital.
Heart attack. Very few of us expect to have a heart attack. If it's just happened to you, you'll be pleased to know that most people recover to lead a full and active life. Heart attacks occur when a blood clot forms over a narrowed, roughened part of a coronary artery, stopping the blood supply to the affected part of the heart muscle and causing symptoms. Although the heart attack may be sudden, the fatty narrowing or plaque in the coronary arteries has developed over many years. These fatty deposits in the blood vessel wall cause reduced blood flow to the heart muscle. This may have given you chest discomfort or angina in the past, or your heart attack may have happened without any previous symptoms. What does a heart attack feel like? You may feel discomfort or pain in the chest, jaw, arms, shoulders or back. Sweaty, nauseous, feeling sick, shortness of breath, faintness or lightheadedness or palpitations, feeling your heart beating. You may also vomit, feel and look unwell. In hospital, a clot-dissolving drug may be given to help open the artery, to restore the blood flow, to lessen the damage to the heart muscle. This is why it is so important to come to hospital promptly if you have more than 20 minutes of these symptoms not relieved by the GTN spray. How do we know you've had a heart attack? First, what you tell us about your symptoms. Second, examination by the doctor. Third, blood tests, which measure any damage to heart muscle cells and how much damage. And finally, a series of ECGs, electrocardiographs, usually show changes to help make the diagnosis. Many people find it hard to believe they've had a heart attack.
Always been a very sporting sort of a person. I fish, dive and motorbike, and never expect anything like this to happen to me.
I just about refused to believe that I'd had a heart attack.
Other feelings may be fear, anger, frustration, and depression. These reactions are normal and usually happen in the first few days or when you're back at home.
It was a shock. It was really a very emotional time, a very painful time working through all the issues that went with the heart attack.
My family and my friends have reacted with a lot of shock, knowing how I'm such a sporting sort of a person, and they've all said they're now drinking herbal tea, and they just cannot believe it, how it's happened so suddenly.
These feelings are best helped by having a clear understanding of your condition and by telling people around you how you feel.
Well, I come from a very close family. In fact, one of the hardest things was I was going to have to explain to them that I was in hospital having suffered a heart attack. I was really worried about how they were going to react to it.
This may also be a difficult and worrying time for the people close to you. We hope to include your partner in discussions about your treatment and recovery. Discuss any concerns you have with nursing staff and family.
It can be as upsetting to you in some ways as it is to the person experiencing it, because you're suddenly having to face lifestyle changes and all the emotional side of it, and coping with particularly, I think, the financial side of things.
The cardiac program will provide support and information in the weeks following your heart attack.
We've actually been to 2 lots of cardio classes, and we found them amazing. We found that being with other people who are